Hi guys, so I've got Darren here today. Darren's model today for me. He's suffered with a bit of back and neck pain in the past, and what I'm going to try and do now is just get him breathing properly, get his rib cage moving, get some nice mobility, really help calm down his nervous system, and it's going to help his neck and his back muscles. Okay, so Darren, what I'm going to get you to do is I'm going to get you actually to breathe deeply in through your nose. Okay, really expand your lungs. Okay, and then what I want you to do is breathe out and breathe about 3 times longer than as you breathe in. So as Darren breathes in there, what's happening, his lungs are filling up, his diaphragm is actually contracting. When that happens, it actually expands. It's going to make his pelvic floor descend, and as he actually breathes out, then his pelvic floor will ascend, his diaphragm relaxes, and then it's going to expel the air out. When you breathe through your mouth initially, like a lot of people do when they're breathing in, it actually kicks off the neck muscles, as I discussed in the last video. And that's really bad then, because that's going to tighten up your neck. So nasal breathing is really important. Breathing in through your nose, down into your lungs. Then when you're breathing out through your mouth. Second to that, as he breathes out, he's also going to activate his abdominals, rectus abdominis, and also his obliques. Now the reason why that's really important is when those muscles are very activated, they're going to help the rib cage move. Not only that, they're going to help the back, around the back here. The lower back muscles called iliocostalis, not that you need to know the name of them, they're very often the muscles that are very, very stiff. And when these guys are working at the front really, really well, they're going to give that a break, and they're going to help with the back pain. Okay, feel okay? Yeah. Now what he could also do, Darren, is he could bring up his knees, and this is going to flatten out the lower back, and we could continue with the cycles of breathing. For somebody who's got back pain, they might prefer to have their knees up like this, and you can still do the breathing, and it really, really helps. So this is the first part, and it's called rest and digest, and I do a lot of this with patients with acute back pain. So now what I'm going to do, Darren, is I'm just going to help depress his rib cage a bit. So Darren, what I'm going to get you to do is I'm going to get you to take a big deep breath in, and then as you breathe out, I'm just going to push down on the lower part of your rib cage. So I'm going to push down, and I'm actually then pushing in and retracting his rib cage, and I'm just trying to get it into the right dimension of where it needs to be. So breathe in again there, Darren.